Now on the show, a look at vaccination of children in the United Kingdom. All 12 to 15-year-olds in England will be offered a COVID vaccine after the top medical advisors said that the children would benefit from reduced disruption to their education. The British government confirmed that the offer would be extended to all children aged 12 to 15 after unanimous recommendation by the chief medical officers from the 4 nations of the UK. Rollout in England will begin next week. The children will be offered the Pfizer vaccine. Vulnerable children in the age bracket were already eligible for the shots. Now in the US, Israel and some European countries, they've already rolled out vaccinations for children more broadly, putting pressure on the British government to also follow suit. Well, to talk more about this, we're joined by Dr. Rajay Narayan, Director, Global Health Alliance, UK. Thank you so much, Doctor, for joining us again. And if you could give us more details of this program, it's going to be rolled out from next week in England.
Yeah, thank you, Gargi, for having me on the show. As you said, that the JCVI initially wanted to wait and watch to see what the side effects were, because as you know that in America, there were children who were getting some myocarditis, inflammation of the heart muscle, and that was the concern in the UK as well. But now the JCVI and obviously the group of experts in the UK, including the pediatric group experts, they have all looked into the side effects of the vaccine, and obviously they have done their own trial on about 2,000 children between the age of 12 and 15, and they found that the side effects were almost negligible. And it obviously, the benefit outweighs the risk, especially with the schools opening this week. It is important that we try and vaccinate our children and keep them as safe as possible, because again, we know that some children do get it, although majority of the children will still get only the mild version of COVID. As we know, globally, that has been the case. But again, it is important to try and protect most of them as much as possible.
If you could tell us more about, these cases of myocarditis that are being reported, if you explain what is it? It's concerning the heart. Also, it's being seen more in boys than in girls, and it's also very, very rare, isn't it?
It's absolutely very, very rare. So that is what I would like to assure, that the numbers were extremely negligible. It was about 5 to 10 per million in America. So what happened that in America, that they found that when they were giving the Pfizer vaccine, especially after the second dose, there was inflammation of the muscles of the heart. So again, myocarditis is a situation where the muscles around your heart gets inflamed and causes infection, and that is what myocarditis is. But again, the numbers were very, very small. Majority of them, they still made a good recovery from the myocarditis. So again, nothing to worry about, but some people can have some long-term complications like heart rhythm problems or heart failure or other complications can happen. But the numbers are extremely, extremely rare, so I would not worry at all.
And that's why you've decided on just one jab for children between 12 to 15?
To start with, yes. So that is what the government is trying to roll out today. The Prime Minister is likely to announce this afternoon that we'll start with one jab to start with. Obviously, as I said, that is an ongoing research. People will have to look at more evidence. But the committee, as for now, the chief medical officers of the 4 nations are now in agreement that we should start vaccinating our children soon.
All right, and what are the worries around it? About in the population, among parents, has there been a lot of have people been wanting the vaccinations for children, or has there been a lot of suspicion around it?
So most of the countries in Europe have started vaccinating their children, and that was the concern in the UK, because again, the parents here were very keen. Especially the schools have opened up this week, and obviously with the schools opening, the chance of the infection spreading goes up. We know that we are almost getting about 35 to 40,000 positive cases every day still in the UK, although the number of admissions and deaths are extremely low compared to the previous waves of COVID. But again, it is, as I said, that it's important to make sure that they completely protect our children, and that is why there are some concerns raised from the parents group and the school children groups that we should try and vaccinate our children and come up with the data. And that is what the UK JCVI and the expert group has come out. They're saying that, yes, we can go ahead and start vaccinating the children.
But there's not a vaccine mandate. It's not, necessary or mandatory for children to get the vaccine before they go back to school?
No, it's not mandatory. So again, they are being just offered. So again, it is for people who really want their kids to be vaccinated, because again, like most of the treatment, you have to offer to the individual, and it's up to the individual decision whether they want the vaccine, whether they want the medicine. So again, it is being rolled out as an offer for children between 12 and 15, and people who want to take it can take it. It's not mandatory.
All right, and they have to get the go-ahead from their parents to actually get the vaccine.
Correct.
All right.
Yes,
and as
yes,
you said, in
absolutely.
Europe, we're already seeing a lot of countries are vaccinating children, because here in India also we haven't started. So we're watching all this very closely, and hopefully in a month or two we should also get vaccines for children. And in the UK, they've looked at all these experiences, especially in the US and in Canada, where they started earlier on.
Correct. So most of the countries in Europe where they have started vaccinating, and the good news is that most of them have been safe. There have not been big reports of any myocarditis or inflammation or side effects from the vaccine. So I would like to reassure people who are trying to get their children vaccinated in India that do go ahead and get your children vaccinated when the government starts it, because again, as I said, that the government in the UK has now done its independent research on about 2,000 children between 12 to 15 recently, and majority of the data is very, very reassuring.
And why is it that only the Pfizer vaccine will be given and not the AstraZeneca, because that's the one that's available here in India?
So the research is on the Pfizer vaccine and the Moderna. So again, the government has looked into both the Pfizer and the Moderna. We are still again doing more research on the AstraZeneca. So I think hopefully in the coming weeks we'll have some more data on the AstraZeneca as well.
All right. And doctor, about COVID infection in children, there's been talk about how children don't get very severely affected by COVID, but now there's also information that children do suffer long COVID, that's also being seen in children who do get coronavirus. What do we know about that?
So again, that study again came out from the UK, but that was looking mainly in people and children who were immunocompromised, who are pre-existing medical problems. So healthy children did not suffer long COVID. Majority of them were saved. Majority of them, they just came out as a normal flu, like that would have just mild sneezing, cough, cold, fever, and come out in a few days' time. But there were some cases in immunocompromised children in the UK who had some long-term COVID symptoms. But I'm sure these are not very life-threatening. They're not going to cause any major long-term complications. These are again problems which make you feel slightly tired, slightly weak for the foreseeable future, maybe a few months. But majority of them are coming out of those problems. I would not worry about it.
And in the UK, what is if you could just share with us the experience so far after the restrictions have been lifted. Now the next stage is going to be the reopening of schools, and the majority of your population has been vaccinated, at least the adult population.
Yeah, so we have vaccinated more than 90% of our population with the first dose, more than 80% with the second dose, which is a big achievement. Although we cannot compare UK and India because the size of the country is hugely different.
Yes.
But the good news is that we have opened up the schools, and the numbers have still remained around 30,000. The positive cases have not gone up. As I said, the number of admissions and number of deaths are also very, very low compared to the previous waves. And this is, again, only because of the vaccination. The excellent vaccination work that the UK government has done is responsible for less hospitalization and deaths. And that is why life is almost back to normal in the UK. There is no restriction. There is no face mask mandatory rules anywhere in the country. So again, it is very, very reassuring that the government has done an excellent work when it comes to vaccination and protecting the people of UK.
And now some concerns going into the winter months. Finally, if you could tell us a bit about that.
So winter is always a concern because again, we get lots of flu in winter. And the advice is that we are going to roll out our flu jabs as well. And there's a possibility that when we roll out our booster dose, we'll have the flu and booster dose together. So that is the plan that the government is looking into, and we'll have some more information in the next couple of weeks. And as I said, that the flu is always a bad season for the NHS because again, especially people who are immunocompromised are likely to get more flu. And that is why we are trying to get our flu jabs out very soon. So hopefully the booster and the flu will be given to immunocompromised and healthcare workers to start with.
All right. Thank you so much, Dr. Narayan, for speaking to us here on the program.
Thank you.